We come together to talk about the surprise medical bills that too often leave patients and their families in financial jeopardy. I know that these days much of our healthcare debate rightly focuses on helping people get insurance. Yet as we strive for universal coverage, the fact is that even for Americans with insurance, our system is far from perfect. Healthcare coverage is supposed to protect you from financial ruin in the event of an illness or an injury. But as our guests Meredith and Liz will tell you shortly, it doesn't always work out that way. Every year, millions of Americans with health insurance are blindsided by unexpected medical bills. I've heard from people like James in Summers Point, who had surgery at an in-network facility, but was charged thousands of dollars by an out-of-network anesthesiologist. Obviously, an in-network, you have an insurance company, they create a network of who you can go to, hospital stay or surgery procedure. You go to that entity, then you should not be charged. But at that entity, there may be someone who is a provider who is not within your insurance company's network, and that's where the surprise comes in. Or consider Ryan's story. Like most people, Ryan didn't fully pull out his provider directory after slicing his finger in the kitchen. He rushed to the nearest emergency room in Bayonne, where he was charged $17,000 for a few stitches. Most of us have experienced something like this, or know someone who has, and it's infuriating. So say your in-network doctor orders an MRI, and though you go to a preferred facility, an out-of-network radiologist reads your scan. Or consider Meredith's story. She had an in-network physician deliver her baby at an in-network hospital. Yet, like so many new moms, she was whacked with a surprise bill because her epidural wasn't administered by a preferred provider. And as Liz will soon tell you, if you are in critical condition, you might not get to choose where you get life-saving care. So I was proud to see New Jersey be a leader, as Phyllis suggested on this, or said, on this issue when Governor Murphy signed the Out-of-Network Consumer Protection, Transparency, Cost Containment, and Accountability Act. If you can say that 5 times, Georgetown University recently studied a similar law in New York, and it found that it dramatically reduced consumer complaints on this issue. But state laws only go so far, and they don't protect everyone. Polls suggest that 2/3 of Americans worry about unexpected health care costs. That's not surprising, considering Federal Reserve data that indicates that 4 out of every 10 Americans don't have enough savings to cover a $400 unexpected expense, let alone a $4,000 medical bill. Medical debt, unfortunately, remains a leading cause of personal bankruptcy in the United States. So I've introduced legislation in the Senate to protect Americans' credit scores from being damaged by paid off or settled medical debt, but we need to do more to protect patients from incurring this debt in the first place. That's why I recently joined a bipartisan group of senators to co-sponsor the Stop Surprise Medical Bills Act. Under our legislation, patients would only be charged their standard in-network copays and fees when they unexpectedly receive care from an out-of-network doctor or hospital. In fact, our bill removes patients from the hassle of settling out-of-network claims altogether, instead creating an independent mediation process for providers and insurers seeking to work out their billing disputes. And if these parties cannot reach an agreement, we require that doctors and health providers be reimbursed at the typical in-network rate for their region. It shouldn't take a PhD in healthcare policy to navigate our healthcare system. It's time for Congress to protect all Americans from financially devastating out-of-network medical bills. We need to build a more transparent, sustainable healthcare system, one that protects hardworking families from financial ruins and puts patients first. The Stop Surprise Medical Bills Act is common sense, pro-consumer, pro-patient legislation. With 21 bipartisan co-sponsors on board, it's time for the Senate to take up the Stop Surprise Medical Bills Act.